The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It looks like acne, but it's not. What is rosacea and how do you control it? Innovations in the treatment of psoriasis could mean new hope. Facing the world with a smile, how can you make yours whiter? Need a dentist? Screen them before you ever make an appointment. Obesity, it's a killer that can be controlled. Vital issues, important solutions. Today on Today's Health. Today's Health is brought to you in part by Dermic Labs, BioGland Pharma, Jenny Craig, the Denmat Corporation, and Futuredontics.
We're now living in the decade of the brain. It's a time when doctors and researchers are finding out more about what's between our ears than at any point in history. The results have already been astounding for the more than 14 million Americans suffering from serious mental illnesses. But there's still so very much to learn. Hello, I'm Faith Daniels, and this is Today's Health. You know, we're all vulnerable to both mental and physical diseases, but we're not defenseless. Today we'll explore some ways we can fight back to prevent, control, and cure the serious threats to our health.
It's a horror that happens in high school, usually on the most important nights of your life. Pimples due to acne. But wait a minute, isn't acne supposed to fade into your past with our high school yearbooks? What about the many people in their 30s and beyond who are waging a daily battle against pimples and redness? About 13 million people in the United States have a chronic acne-like condition of the facial skin called rosacea. It's sometimes called adult acne, but the two conditions are very different. Rosacea usually starts where most people blush, and it can get worse if it doesn't get treated. Blushing, stress, alcohol, heat, sun, exercise, and certain foods can trigger and aggravate the condition. Probably the most famous example of rosacea is W.C. Field's classic bulbous nose. Although the condition may have been aggravated by his infamous drinking, it was actually the result of advanced rosacea.
Acne, or acne vulgaris, and acne rosacea are two very common skin conditions. Basically, both are associated with the redness of the face, pimples, pustules. However, with rosacea, which is often called adult acne, the major feature is dilated blood vessels.
In advanced stages, the nose may become red, bumpy, and permanently swollen from excess tissue. Acne and rosacea may sometimes look similar, but they are different conditions and are treated with different medications. Recently, for acne, doctors have found a combination of topical antibiotics and benzoyl peroxide, like benzomycin lotion, may be more effective than simply one or the other. And although there is no cure for rosacea, an innovative formula of sodium sulfacetamide and sulfur, like Sulfacet R, developed by Dermic Laboratories, can often dramatically reduce the severity of the disease with minimal irritation.
Neither acne nor rosacea are life-threatening illnesses. Both rosacea and acne have a physical impact and emotional impact as well.
If you think that you may have rosacea, it's a good idea to see a dermatologist. Untreated, the condition can get worse and become more apparent. No one wants to deal with a facial condition like acne or rosacea, but these disorders don't have to affect your life or self-image. Innovative skin treatments can help keep these conditions under control so that you can always put your best face forward.
We'll be back with more on Today's Health.
Did you know that arthritis has been around longer than humans? Fossils show that even the great Tyrannosaurus Rex could be brought to his knees by the pain of this progressive illness. Fortunately, modern medicine is finding solutions to arthritis and other diseases.
They say beauty is only skin deep, but But many people who suffer from psoriasis take little comfort in that old saying. The emotional pain and trauma suffered from the disfiguration caused by this disorder can lead to embarrassment, loss of self-esteem, and even depression.
My experience was that I completely dropped out of all social activity, intimate and otherwise. I would not go out. I would come in from work when I was going to work, or when I did go to work, and immediately go to my room, go to the bed, and close the door. And I did that for 2 years. But for me, and I think for a lot of people, is that you are really ashamed of what you look like.
Psoriasis is a serious chronic skin condition that affects as many as 3 in 100 people. It occurs equally in both men and women and is usually first seen in individuals in their 20s and 30s.
Psoriasis is a very common skin condition. It's not contagious, but it's a rash that is very scaly. Scaly means dry, itchy, and underneath is highly inflamed.
Virtually, it has taken over almost every facet of my life, but I have been going to the doctor almost every day for the past 3 years.
Unfortunately, no, there isn't a cure, in that there is no way of taking away psoriasis and making sure it stays away forever. But of course, there are a number of ways of relieving psoriasis and controlling it and trying to keep it as good as possible. Anthralene cream's been used for many decades now in the treatment of psoriasis, so we know a lot about it. But of course, from the patient's point of view, with the old anthralene preparations, you used to get problems with burning or staining of the normal surrounding skin and staining of the clothing as well.
Recently, however, researchers in Sweden have found a more effective way to deliver the treatment, which makes staining of the skin and clothing a thing of the past. Myconol, which was recently introduced by Bioglan Pharma, is a 1% formulation of anthralene. Myconol virtually eliminates the drawbacks of skin staining and irritation associated with the older anthralene formulations because the anthralene particles are microencapsulated with lipid crystals. This microencapsulated delivery system, called Crystallip, keeps the active ingredient encased and unexposed to oxygen. When the lipid crystals meet the skin temperature, the portion in contact with the skin melts and delivers the drug. The lipid encapsulation system can control the release of the active ingredient better, eliminates the need for preservatives that can further irritate the sensitive skin, and reduces the potential of stains on skin or clothing.
It's extremely important to have every kind of clinical remedy available.
Living with psoriasis is a constant challenge both physically and emotionally, and until we find a cure, delivering the treatments we have more effectively could bring new hope to the people trying to cope with this lifelong disease.
This year, more than 1 million new cases of cancer will be reported in the U.S. Cancer is the second leading cause of death in this nation, but it doesn't have to be. With early detection, you can survive most cancers. Here's one more reason to get a regular checkup.
When you're smiling, the whole world smiles with you. You've probably heard that song many times. Your smile is your calling card to the world. When you flash your pearly whites, it can be magic. But for some of us, our teeth are not as white or as bright as we would like.
Some of the reasons people have stained or discolored teeth are that some people just have stained teeth naturally. Some people have stains due to the foods they eat or what they drink, sometimes red wine, coffee, juices, teas, tobacco. Also, some people have stains due to antibiotic staining.
There are 3 options in selecting a bleaching program. The first one is called Accelerate, and that's the Rembrandt in-office bleaching as well as take-home bleaching. The second option is Gel Plus, which is just the take-home bleaching. And the third option is the Dazzling White, which is a toothpaste as well as a bleaching gel that patients use over about a 4 to 6 week period.
I was leafing through old photo albums and I was looking at my own photos and I realized I wasn't smiling in photographs. I went and looked in the mirror and tried to smile and realized I had a hard time doing it until I opened up my lips and I noticed some yellow, dingy teeth.
It's up to the patient and their dentist whether to treat at home or in the office. Some bleaching treatments, including the Rembrandt whitening programs developed by Denmet, offer procedures for either option. In the office, the dentist can apply a whitening solution like Quick Start, or a special form-fitted mold can be made at the dentist's office, and the patient can apply treatments like Rembrandt bleaching gel at home during the day at their convenience. In some cases, for more rapid and dramatic results, the dentist may recommend a combination of in-office and at-home procedures like Accelerate.
I chose to have my teeth whitened because I felt my teeth were getting dull, dingy, and yellowing. My treatments lasted on and off 2 weeks because I worked at home, alternate evenings. It was really quick. There was no pain at all in the treatments whatsoever. It was very easy.
Bleaching teeth is not new, it's not experimental, it's been around for years. We've been treating non-vital teeth or teeth that have had root canals for well over 40 years.
Usually the whitening treatments last for years and years and years. However, what we suggest to patients is if they see their teeth darkening just a little bit, to do a booster bleach in 6 months and then evaluate it again.
If you want whiter teeth, there's even a toothpaste and bleaching gel combination like Dazzling White you can buy off the shelf. They can lighten some stains by several shades. But just like any other change that will affect your body, it's a good idea to discuss your options with a health professional.
Now that it's over, I'm really quite pleased. It's nice having a white, bright, nice smile. When I'm with other people in a social setting, I'm not conscious about how poorly my teeth look. In fact, I'm conscious of how great they look.
A dazzling smile is contagious and can make everyone around you feel a little better. So whatever you do, keep on smiling.
When it comes to health issues, there's so much to discuss and so little time to cover it all. If you want more information about any topic you see on the show, browse over to our website at www.vstar.com and we'll hotlink you right to the source. You've heard of the city that never sleeps. Well, the United States may be the country that never sleeps. More than 30 million people suffer from insomnia. But there are treatments available, so if you're sleepless, see your doctor. Here's another important health issue.
Do you take your teeth for granted? Many people do until it's too late. In fact, some statistics show about 40% of Americans over the age of 65 have lost many, if not all, of their teeth.
Your teeth need to be taken care of just like any other part of your body. A regular dental visit twice a year and practicing proper dental hygiene every day can help keep your gums healthy and your teeth strong.
People need to go to the dentist regularly because they just can't clean their teeth themselves. I mean, you can brush and floss all you want. You can do it 2 or 3 times a day, but there's areas of the tooth you can't brush or clean by yourself. So it's important that you get to the dentist and that they do a little bit deeper cleaning. Some of the benefits of regular preventive dentistry is that the dentist or the hygienist will find things that you don't know about. That's one of the reasons we take x-rays.
Many people who agree that regular dental visits are important don't have a dentist. For these people, a referral service like 1-800-DENTIST, managed by Future Dentics, may help. This one offers patients a toll-free number and a pre-screened selection of dentists. The service pre-screens the dentist for qualifications, dental school, years in practice, and accreditations with the American Dental Association and the Academy of General Dentistry. They also screen to make sure the office meets the OSHA guidelines for sterilization, and they visit the office to evaluate the facility and equipment.
Well, we didn't have a dentist in this area because we had lived back east and we moved here. And also, since I had my daughter, I didn't have anybody who I knew was good with kids. And I really wanted to know a little more than that, about background, about location, about who was good with, again, with children. And that was answered for me at 800-DENTIST.
A referral service should be able to answer questions like, does the dentist handle children? Or emphasize on procedures like whitening, implants, surgery, lasers, or even porcelain veneers.
I called 1-800-DENTIST because my teeth looked sort of almost a little yellow, and I thought, you know, I'm getting to a point now where I've got to get in and see a dentist. It had been like a year.
There are a lot of new things happening in dentistry that make the procedures more patient-friendly. For one, we have lasers. And lasers can be anything from argon lasers that will cure the composite materials faster to air abrasion, where you don't even need to drill a tooth. You can use an aerabrator and just abrade away the decay.
Merely to eat, we average nearly 1,000 chews a day. And few things can light up a life like a bright, beaming smile.
Whether you're 1 or 100, strong teeth and healthy gums are important. And choosing the right dentist and the proper dental program for your needs can help you preserve them for your entire lifetime.
We'll be back with more on Today's Health.
Here's a good question. What's your body's largest organ? Believe it or not, it's your skin. Your skin does so much more than protect your body from outside elements. That's why it's so important that you care for it properly and limit your exposure to the sun. Now watch this.
Life in the fast lane, that's the 90s. Concerns about exercise and diet are too often sacrificed to onrushing deadlines and high-stress schedules. The pounds can sneak up on us, and that can put our health at high risk, especially if you are among 1/3 of all adults and 1/5 of all adolescents in the United States whose body weight falls in the category known as obese.
Obesity is a troubling epidemic in this country. It is linked to over 300,000 deaths each year. And this overweight condition affects nearly 78 million Americans.
My relationship with my weight has affected my life in so many ways. Out work, going to school, every way I can think of. It's sort of kept me inside of myself.
Obesity is not simply a cosmetic challenge. It can be a very serious health, financial, and psychological issue. Clinical studies have shown that people who weigh 20% more than their ideal body weight can be at considerably greater risk for cardiovascular disease, hypertension, high cholesterol levels, osteoarthritis, diabetes, and even some forms of cancer. Obesity also takes a serious toll on the economy. Every year, it costs Americans over $100 billion in medical treatment, lost wages, and lost productivity. Obesity can also be psychologically troubling and negatively impact an individual's self-esteem and personal well-being. Experts agree that while many individuals can lose weight successfully, for most people, the greater challenge comes when trying to keep it off.
There are both social and medical advantages to losing weight. People who lose weight usually feel better about themselves, and we, in our own research, find improvements in things like depression, in self-esteem, and the like. But probably more important than that are the medical benefits.
Many experts believe that the key to success includes a comprehensive weight management program of healthy eating, exercise, and a new mindset to modify past behaviors. Comprehensive programs like the ones available from the personal support consultants at Jenny Craig Centers can help bring down weight and maintain it at a more healthy level.
I've tried everything to lose weight, medical programs, wafer programs, liquid diets, starvation programs, just about everything I could think of.
Losing weight is a matter of a lot of things, not just dieting. If people can make moderate changes in their lifestyle, can manage their eating a little bit better, and make moderate changes in their exercise, the weight loss will follow, and good health can follow from that as well.
The personal support at Jenny Craig was invaluable to me. If I didn't have that, I don't think I could have done it. It's wonderful to know that anytime you're feeling low or feeling down, that you could pick up the phone and that someone would be there for you.
Personal support can be very helpful for some people because you're into a weight loss program for the long haul usually, and there are ups and downs, and it always helps to have a nice pat on the back.
If you think you or a loved one is dangerously overweight, it's important to look for safe and effective programs that help reach weight management goals. There are lots of magic potions being promised out there.
Miracle diet plans and quick fixes are often more dangerous than they are helpful.
A comprehensive program that teaches you changes in your lifestyle, namely your diet, your physical activity, and the way you think about yourself and your eating can lead to the greatest long-term improvements.
Since no two people are the same, no two custom-tailored weight management plans are exactly alike. A program that starts with a review of the individual needs of a person, whether it be nutritional advice, a personal fitness plan, or even an examination by a physician for medical therapy, like this new program option at Jenny Craig Centers, can help identify an individual's specific needs and goals, and even prescribe the proper medication if necessary.
During the weekly sessions, I sit down with my personal consultant, and we spend as much time as I need on planning my week, choosing my food. It takes into consideration every aspect of your being, your inside and your outside.
The groups can be helpful in giving you a sense that others share the problem, giving you a lot of good ideas, but also it becomes a source of support and a point of accountability in a way. You want to do well because other people in the group are urging you on and encouraging you. So it can be a very helpful thing indeed.
Obesity may be a killer that's a factor in more deaths each year than any other health hazard except cigarettes. This makes weight management stand out as a critical element for good health.
It's wonderful that I can go once a week and have a touchstone so I can weigh in, and it's usually exciting because you've usually dropped some weight. And if I haven't, and if I've plateaued, which happens from time to time, there's always someone there to get you through it, to remind you that that's just normal. I feel different about myself now that I have a program with such a comprehensive plan. I feel terrific. I look in the mirror every day and I really like what's there. It's made me much more open. I don't hold myself back anymore. I really put myself out there in the world and don't get depressed and sad like I used to. See the world in a whole new way.
Our health has an important impact on our happiness and well-being. In fact, an old saying sums it up. When you have your health, you have everything.
High technology and advanced research have given us some extremely effective new tools in fighting many types of disease and illness. Recently developed cures and treatments are literally miracles of modern medicine. But when it's your health that's involved, what's truly miraculous is never having to depend on a miracle. I'm Faith Daniels. For more information about any of the stories featured today, contact us on our worldwide website at www.vstar.com. And join us again next time as we get right to the heart of matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.